Hi, I want to thank everyone for joining us tonight to talk about the Thymosin Alpha 1. I'm really excited about this product and the ability to talk about it on this webinar because it's my favorite. Out of all the peptides we offer or considering offering, this one is still my favorite, just due to its diversity, its power, and the effects I've seen it have on some patients. So I highly recommend this product, and hopefully this webinar will show you why I love it so much. It really is an amazing product, and I cannot wait to tell you all about it. Just to start, I wanna talk about this in terms of practicality. The Thymosin Alpha 1 is an amazing product, but a lot of the times, a lot of people don't think it has a direct connection to what they see in their sort of anti-aging or health optimization practice. I'm hopefully going to argue that it is, and that it's an important part of any practice. But I just wanted to start off with a little bit of an idea of how it can help in terms of its pleiotropic effects. And so we're going to find out about how it reduces inflammation. We're going to find out about how it increases the innate and adaptive immune response. We're going to learn how it helps fight infectious disease. We're going to learn how it helps tamper down cancer, and then correct immune deficiencies, or even in some cases immune overactivation. And so how would I use this just in the very beginning? If you have anyone in your practice who has any type of viral infection, any type of autoimmune condition, if you just want to generally help with the aging process, or anything such as increased inflammation, or just etiologies where you're not really sure where to go to, this is definitely one that I hope everyone considers. And so with that, I definitely want to go a little bit more into the history and the historical perspective. The thymosins were discovered in the mid-1960s in New York, whenever the role of the thymus was just being studied in terms of the immune system. Here I put from Dr. Goldstein several quotes about the thymosins and when he identified their significant role in immunity. In particular, two of the small peptides which he highlighted are ones that we still use frequently, I would say, in clinics all across the U.S., and that's the Thymosin Alpha 1 and the Thymosin Beta 4. And he said the physiological processes of these peptides effect include stimulation or suppression of the immune responses, regulation of actin dynamics and cell motility, neuroplasticity, repair and remodeling of vessels and other tissues, and stem cell differentiation. So that hopefully speaks to a little bit of the power that some of these thymus peptides actually have. Sort of going beyond that, I also want to just give a little bit about its actual structure. The thymosin also goes by the trade name Sedaxin. It got FDA approved in 2013 with orphan drug approval. So basically, it was fast-tracked just due to all the effects that it was having. It was being studied simultaneously in hepatitis C, hepatitis B, malignant melanoma, in a bunch of other cancers, and that actually is what it got approved for, hepatitis C, hepatitis B, and malignant melanoma. It is a 28 amino acid peptide derived from a natural prothymosin alpha product, which is produced in your body. And it does have several variants. Thymosin alpha 11, for instance, is just as active in the body, but just produced in smaller amounts. And it's mainly an immune modulating peptide. Sedaxin is the commercial name produced by Cyclone Pharmaceuticals, and I'll be sending out some of their monographs with this presentation to everyone in the Body Logic registry in order to get some more information. The other thing I want to say is that in 1985, it had its first clinical trial. So this is a long time ago, and a lot of work has been made since it got FDA approved. And this table is really a quick cheat sheet in all the things that it does in terms of how it affects tumors, what happens with T cells, and then how it's also modulating other responses as it relates to cytokines. And this one is really interesting because again, we know which markers we wanted to measure, particularly CD34, CD4, CD8 cells. People will also measure CD57, natural killer cell activity, or T regulatory cell activity. It also goes into a little bit about how it affects tumor cells. I'll be going into that a lot more later, but for now, I just want to go ahead and mention the one thing I won't go on to later, which is it increases GSH levels, which are obviously another benefit that I won't go into detail with too much later. So again, this is the thymosin alpha mechanism of action. It's pretty diverse. What we have is that we have the thymosin alpha 1 peptide hitting a lot of different cells. It's encouraging stem cell differentiation first and foremost into the immune cells that we really want to emphasize. In particular, cytotoxic T cells, T helper cells, T regulatory cells, natural killer cells, and to some degree, it promotes antibody production via B cells. And all of this results in just a better immune response. And so, in particular, the two things you'll see definitely in the blood are that it's going to promote IL-2 and the interferon gamma production and inhibit IL-4 and IL-10. This is also an important thing. If you saw a webinar I did a while back on neuroinflammation or the new products that TaylorMade is offering, the IL-4 and the IL-10 are also big components of neuroinflammation. So sometimes, and again, I won't go over this much later because there's not much data on it, but people will use this even in things like Asperger's or some spectrum disorders in order to tamp down neuroinflammation. But all of this results in a better immune system response. And then lastly, you have an MHC class 1 expression on virally infected cells, which obviously helps all these immune system cells basically find virally infected cells and tumor cells in order for clearance. And again, it has multiple other actions. It enhances dendritic cell response. It's going to block steroid-induced apoptosis of the thymocytes. It protects against oxidative damage. One of those is, like I said, with increase of GSH. And as we talked about, it already is used for the treatment of any type of virus. It's anti-tumor, and again, helps promote effective vaccines as well. So the other thing I want to talk about is just thymosin alpha 1 and aging. As we age, your immune system will decline, whether it be from the short telomeres and T cells, just regular immune senescence and the involution of the thymus, increased inflammation and oxidative stress, multi-hormone decline, neurological functioning decline, decreased cellular energy production of NAD in particular levels, as well as ATP, decreased protein synthesis, decreased detoxification, and tissue and organ atrophy. Again, all of these things go down, and thymosin alpha 1 can actually affect all of these in a different way. One of the ways is, along with all of this, thymic involution is definitely to blame for some of these things. And that results from a Th1 to a Th2 shift. So what you do is you get more cytokines, you get rapid progressors and susceptibility to faster type of cytokine storm. So much more increased inflammation, and you get, instead of decreased IL-4 and 10, you get much more increased IL-4 and 10, and therefore chronic illness becomes a vicious cycle, and that's when you get some of these inflammatory mediators coming constantly and stressing the cell metabolically. This can present itself in a variety of different ways, such as sluggishness. We've seen this help in things that are hard to quantify clinically, like things like fibromyalgia, chronic fatigue. This is definitely the mechanism of action which we think we can sort of help those things. And then obviously you increase your risk of opportunistic infections and intracellular infections, autoimmunity, inflammation, and cancer, all of which is fixed to some degree by the thymosin alpha 1 stimulation. We also know that the immune dysfunction is associated with a wide variety of common illnesses, and this is again where you might be able to identify in some of your patients the need for immune support. If they're having a lot of oxidative stress, if they're having chronic pain, if they have chronic fatigue or fibromyalgia, if they're having just even emotional stress such as depression, it might be an okay time to think about the thymosin alpha 1. I can tell countless stories where people have had just vague symptomology that indicates just I would say lack of ideal functioning. And with the risk profile of the thymosin alpha 1, it's definitely one to consider just to sort of help them get on the right track. Again, here we go to sort of the mechanism of action. This is the mechanism of action, particularly in cancer. The thymosin alpha 1 actually directly suppresses viral and tumor replication and increases the viral and tumor antigenic expression on a cell. So basically, what we do is we get increased MHC class 1 expression, as we've already talked about, of those tumor antigens, which again decreases that viral replication, but also increases the ability for these cells to be seen by the immune system and less prone to escape from any type of clearance from the immune system. And again, this is just another way to show that and the differences in the MHC class 1 expression and the cytokines, which yield better natural killer cell response, better cytotoxic T cell response, and then again, more of those T regulatory, the T helper cells as well. And again, this has been proven time and time again. There's plenty of good data on this. In particular, we see that, versus the placebo, the number of T helper cells significantly increases. This is a metastatic colorectal cancer study done in mice. Beyond that, we see the TA1 increases that Th1 subset. So we see, again, better expression of IFN gamma and IL-2 instead of the IL-4 and IL-10. And lastly, we see natural killer cell activity greatly increases as well, and we increase the mean cytotoxicity of these immune cells. And again, that results in much less cancer, particularly in the colorectal study, but it's been proven in just about every cancer you can imagine. While thymosin alpha-1 only currently has a designation for the malignant melanoma, I think you're going to see it with indications all over in the next coming years, just because of its risk-reward profile. Here is a non-small cell lung cancer study with a double-blind randomized placebo-controlled trial with 42 patients, and the TA1 was given up to 1 year following radiation treatment, and it was statistically significant improvement in relapse-free survival and overall survival, which correlated to T cell, which are obviously depleted with radiation. So this is a good way for any type of therapy, any type of cancer therapy to sort of help those T cells and immune cell functions as it correlates with radiation or chemotherapy. This is another study that I always like to point out. Actually, this is sort of mislabeled. It's not in non-small cell lung cancer, but this is another study out of Russia. If you're familiar with the epitalin, you'll know Dr. Cavinson, who did this study on some of the thymic proteins generally, and he showed that bioidentical thymic protein injected into mice starting really young actually prolonged their mean lifespan by 28% and decreased their risk of cancer by 2.8-fold. So obviously, some really good data as it relates to the thymosin alpha-1. And again, this goes just a quote that I said earlier, but I can't stress enough how effective it is in terms of cancer treatment. I also like to show everyone this phase 2 malignant melanoma trial. This is the study that really kicked everything off in terms of its orphan drug approval in 2007. And the real thing I want to highlight is the survival rates, which was 54% longer in patients with overall survival, and progression-free survival was much higher as well, with a 59% increase in survival. So for any cancer patients, I highly recommend this. I know you all don't see it on a day-to-day basis, but if you do or you have a family member, this is something that I would definitely consider. And again, this just goes into sort of the other pleiotropic effects. So we've sort of covered cancer. We've also sort of covered how it works with the innate and adaptive immune system response and its mechanism of action, and also how that affects inflammation with the reduction of the Th2 cytotoxic or the Th2 cytokine storm type things. I also want to talk about how it's used with vaccines. In particular, vaccines are much more effective whenever they're dosed with the thymosin alpha-1. In particular, it tends to be around, at a minimum, 15% more effective than even given by itself. So you're essentially, and this next slide is a good example, you're much less likely to have contract any type of disease. Particularly in this case, it was a much lower incidence of influenza, and again, just by around 15% lower progression to influenza than not alone. This is also another good example of how you should use it. In particular, people are using it as like a Tamiflu. People will keep lyophilized vials in stock to use the first sign of illness. I can also say that people will take this whenever they travel. I'm one of those. I do not want to get sick in the middle of a travel experience, and so I will use this as well. The next thing I just want to go over is hopefully that explains all the ways it's good. The one thing I didn't really talk about with a high degree is the effect it has on autoimmune diseases. And this is one that is frequently used, particularly in things like lupus and psoriatic arthritis, because you can tell a major difference in the rate of deterioration. For things like Hashimoto's, we might see a reduction of autoantibodies, but it's not always enough to change or clinically change the care treatment strategy. So people might still be on exogenous thyroid hormones, even though it's just sometimes they might see clinical benefit, but not enough to change medication. The Thymosin alpha-1 dosing is also very, very important. Here I've included what the Sedaxin general dosing is, which is around 1.6 milligrams twice a week. We still recommend just around that. We recommend 1.5 milligram vials or 1.5 milligram doses 2 times a week for anyone doing most of the traditional types of treatment for cancer or for or anything like hepatitis C or hepatitis B. I would say we have a very, very few of those, however, and the rest of our patients are typically recommended to do 0.15 ml dosing just about every day. And that is the same dose averaged out over the course of a week. But what we see is we see better results clinically, and I'll talk about a little bit of why we think that is whenever I go to the Pharmokinetics and how this is presented in your blood. The other thing I like to say is that the side effect profile for Sedaxin or for the Thymosin alpha-1 is extremely, extremely low. Right here is actually just an excerpt from the Sedaxin monograph where it talks about its safety record. I mean, it's been used in pediatric patients. It's been used in people with decompensated liver disease, in renal disease, which require hemodialysis. All of that showed good tolerance. Even in the elderly, they have no incidence of any type of significant side effect. One study even lists that side effects are lower than placebo, which is obviously extremely, extremely good to hear, and just talks about the risk to benefit profile. The risk is extremely, extremely low for starting a therapy like this, but the benefit can be immense because it can correct the immune system. And if you're not doing testing for CD34, CD57, IL-2, T-cell regulatory response, then you don't necessarily have to for some of these really complicated diseases, but Thymosin alpha-1 is never a bad idea. Again, I was talking about sort of the pharmacokinetics as well. This talks about this is in particular referencing a single study which looked at its pharmacodynamics. And this is important because we see that the half-life is actually going to be around 2 hours. So it's not going to be active very long like a lot of peptides. But what we want to do here is stimulate that more frequently. So we decided to do the once daily dosing for a lot of types of viral diseases, in particular Lyme and chronic fatigue. Those two are often related, but for treatment of both of those, we see much, much better results, often combined with BPC-157 whenever this is dosed at 0.15 mLs, which would be the equivalent of 450 micrograms daily. And again, it is excreted often in the urine, but almost always broken down in the serum. And with that, I hopefully have made a lot of you all convert to the benefits of the Thymosin alpha-1. I promise it will find a place in your practice if you just keep it in the back of your mind and think about this whenever you see patients. If you ever have any clinical questions, please don't hesitate to reach out to me, and we'd be happy to help. For now, I'd like to open it up real quickly for any questions. And again, just to reiterate, we'll be sending out these slides as well as some of the Sedaxin monographs and presentations by other parties like the International Peptide Society, Dr. Kent Holtorf as well. So if anyone has any questions, I'd love to answer them now. All right, well, I appreciate your all's time again on this Monday. I hope you all have a wonderful week. And if you have any other questions, you can always email me at rs@tailormadecompounding.com. Thank you.